of the training is to introduce you to Westway's new medication administration record. This MAR is for medication information only. So first of all, I'd like to show you a copy of the new MAR. So this is what our new MAR looks like. You'll see the change in the title, Medication Administration Record. You'll note that we're still indicating the participant name. We've still got the month and the year that you're going to be filling out at the top. And in terms of the medication chart itself, you'll note that there's not any changes. We're still have the medication on the far left. You're indicating the dosage, the amount, the hour given, if there's any sort of special instruction, and you're initialing off on the day of the month. So the medication chart itself does not have any changes in the process of how it's completed. However, the size of the chart and the boxes where you are initialing have all been enlarged. So now I'd like to show you a copy of a MAR that's been completed to support a participant. So you can see that I've indicated that Jane Doe is the participant and she's staying with us in the month of March 2018. So I filled it out in terms of her morning medications, lunchtime medications. She has an early evening medication, and she also has some later evening or bedtime medication administration. So first, walking through the bottom left-hand side of your screen, you'll note that there's boxes for service provider, signature, and initials. And there are multiple spaces here to accommodate the number of staff who may be supporting a participant through the month. I'm going to come back to this shaded area in a few minutes, but underneath the shaded area, you'll note that we continue to have the caregiver family signature line where the family would be signing. So the caregiver family signature is always required prior to the administration of any medication. When the caregiver family is not available to sign the MAR, the service provider calls the caregiver family to complete and verify and signs the MAR on the caregiver family signature line. Okay? So continuing through the new sections of the new MAR, we've included a legend now with the MAR. And so you'll note that there's 3 letters here that we're going to use with our legend. So the first one is D for declined. So if a participant declines their medication, all service providers will follow the medication policy and will follow the caregiver direction. The letter D is then entered in the box to correlate with the appropriate date and time. Respite workers will document the direction in the service notes, and at the respite home, this will also be documented in the logbook. So if Jane declines her naproxen for the 7 o'clock dose, then you as a respite worker would be putting in here a D for declined. Okay? The second thing on our legend is it's AO for administered by other. So during a period of respite, if the participant's medication is administered by someone other than the Westway service provider, an AO is to be entered in the box to correlate with the appropriate date and time. Respite workers would document the direction in the service note, and at the respite home, this will also be documented in the logbook. So, for example, if as an in-home respite worker, you're supporting a participant for the day and you're at a family home and the caregiver comes home over the lunch hour and they end up giving the participant their medication, as the respite worker, you would enter an AO on the MAR. So again, if this naproxen dose or both of these meds were given by the caregiver, you'd be putting an AO here in the proper boxes. If the participant was at the respite home and became ill and goes to the hospital for several hours before returning to the respite home, the respite worker would enter an AO on the MAR and document in the service notes and in the logbook, if the medication was administered at the hospital. So again, an example being at the respite home, if the evening dose of the naproxen was given at the hospital, the respite home staff would be entering an AO here. The third part of our legend includes an X, where you'd be putting does not take medication on X days. So occasionally participants are prescribed medication that is not administered on a daily basis. And in order to indicate this clearly, an X is to be entered on the dates that the medication is not to be administered, thereby leaving blank the appropriate boxes where the service provider can initial when they have administered the medication. So if Jane is joining us at the respite home for a 6-day period, it may be that on the first and the second, we're indicating an X here because she does not get the Voltaren only every 3 days. And so on the third, it would be given, you'd sign off. The, the next 2 days would be X'd off, and then this one left blank, allowing you to sign once the Voltaren was administered. Moving away from the legend, we have on the far right the PRNs. And so now, when you are filling out MAR, we want you to indicate whether the participant has a PRN medication, yes or no. And in Jane's case, she does have a PRN. So looking at the PRN side of the MAR, you can see that Jane has one PRN that she gets when she's complaining of pain, and it indicates the dosage, how much, every 6 hours to a maximum of 4 tablets in a 24-hour period. So Jane was complaining of pain at 5 p.m. on the 1st, and so it was administered and the staff signed off. She also has a PRN for Gravol, and the dosage and the amount is indicated. So if she's complaining of nausea, she can have 1 tablet every 4 hours to a maximum of 3 tablets in a 24-hour period. And so she was complaining of nausea at 11 a.m. on the 1st, and so the staff indicated that and signed off. So looking back at the front of the MAR, we also have a section now called additional medication information. And so sometimes there's information that is pertinent to the administration of medication that needs to be included. So you can see here that it's been indicated that Jane wants many of her medications to be given with food. And so further to that, we've indicated that Jane prefers her morning medication mixed with yogurt as per the caregiver direction. And then at bedtime, she likes her medication given with tea, that includes honey and milk in it. So this information is included here because it is relevant to the administration of medication. So at the respite home only, we also have this area, this shaded gray area that is to be filled out. So this shaded area is to be used at the respite home only. At the respite home, staff are required to support multiple participants who may receive numerous medications during the period of respite. And best practice indicates that by verifying the correct completion of a MAR before medication is administered, corrections can be made prior to administration. So when working at the respite home, indicate the name of the person who completed the MAR, and that may be the caregiver or it may be a respite worker. The MAR then needs to be verified, and so the respite worker completing the intake will sign that they have verified the MAR. The second respite worker on shift will verify and sign the MAR prior to the administration of any medication. So lastly, I want to explain about the additional instruction sheets. So families using the in-home service at Westway are not required to use these instruction sheets. However, they are a resource that is available if requested. So I'd like to run through them also that everyone is familiar with them. So this section is to be completed at the respite home when one of the following instruction sheets is required for participants' care. So you can see here that I've got 3 of them listed: a medication-related instruction sheet, a topical medication instruction sheet, and a respite home narcotic count sheet. And I've indicated that Jane is actually using all 3 of the instruction sheets that are available. So first of all, I've done a split screen here. So you can see that this is the medication-related instruction sheet. And I've included the front part of the MAR just so you can see how it correlates. So her caregiver has asked us to monitor her glucose every day before lunch, okay? So at 12 noon. So on the instruction sheet, you're indicating that you're doing blood glucose monitoring. You are indicating the participant name and the date. And so Here, the instructions include that Jane controls her blood sugar with diet and exercise. However, the caregiver has requested that her blood glucose level be checked and recorded daily before she eats her lunch. So her monitoring was done at noon on the first. The staff person has indicated what the blood sugar level was and has signed off on it. Okay, so that's our first instruction sheet. Our next instruction sheet is the respite home narcotic count sheet. So Jane has a narcotic, is one of her PRNs. So therefore this sheet must be filled out. So we've indicated the name of it and the dosage. And here we've indicated that she's going to be with us for 4 days. So when she arrived at the site, the count was done. So at 4 o'clock, there was 15 tablets and the 2 staff have signed off. And then at shift change, the count is done again. So it's now midnight. Brenda has done this with one of the incoming staff, and there are 14 tablets because it was given once through the evening shift. Okay. And our third instruction sheet is what we're calling our topical medication instruction sheet. And so we had a lot of feedback from folks that it would be really helpful to sort of have a picture to indicate exactly where ointments and creams and whatnot would be applied. So again, looking at the front of the MAR, we can see that Voltaren is to be administered each night at bedtime on the front of both of her knees. So looking at the instruction sheet, we can see that it's for Jane. We've got the right month. We've got the medication. We can refer to the front of the MAR to understand how much and what time and where. And as further instructions, it's been highlighted in terms of where she is to receive that particular ointment. So that is our new medication instruction, our new medication administration record. And I'd just like to encourage you, if you have any questions about this new document, to call your supervisor and they can support you and answer any of your questions that you might have. Thank you.